It's a life-changing interview. Okay. Hello, Miss Jessica. Thank you for dear on stroke for healing. Thank you so much. I appreciate it. Tell us, Jessica, tell them a little bit about yourself for our viewers who don't know you.
Yeah. Well, first, thank you so much for having me on here. This is definitely an honor. As Eva said, my name is Jessica Hook. I am a speech language pathologist over at Orlando Health Advanced Rehabilitation Institute. I'm also one of their clinical specialists that looks over their community programs and wellness and used to look over their brain injury program. And I've been with them for about, well, a little bit over 15 years, but I've been practicing as a speech pathologist for over 17 years.
Oh, very good. Look how time flies.
Yeah.
Okay. Ah, thank you so much for being here.
You are.
And the next question is, what does the rehab process look like for most stroke victims? People recovering from a stroke. What does it look like?
Yeah, so it generally, and so that question could be a little different from each person, but from a broad perspective, generally it looks like that a person after they had a stroke, they're going to have a little bit of therapy, what we call acute care, in the acute care setting with the therapist when at right immediately after the stroke happens. So let's say the stroke happened yesterday, that acute care team once they're able to come through are going to come in with the next few days. And that will consist of a speech therapist, like myself, a physical therapist, and an occupational therapist. What they'll be looking at there is, first they'll be trying to make sure that can you sit up, the basics, right? Are you getting out the bed for a little bit? You might not have therapy consistently every day, but they're trying to see where you are, right? And you're at that point, you're still very, very the person is very, very new in terms of the stroke. So there's a lot of education. There a big emphasis put on swallowing. Can you swallow? If you can, what does your diet look like at this point? So you're looking at those basic needs at that point and just getting you set up. After that, the individual might go a couple different ways depending on where they are at in their recovery or how they're presenting. They may be able to go home and do therapy at home or outpatient therapy, depending on the severity of the stroke and what is a family able to care for them in a home at that point in time. A lot of times a family is not able to care for them at home at that point in time. So then there's other two areas that they might go, a few areas they might go to. If they're so for some reason have a trach and they need help managing it, they might go to what we call a transitional care facility that's focused more on the trach. Or they might go to a skilled nursing facility for some therapy, short-term rehab, if they need a little bit more therapy, but they can't handle the intensity of having it rigorous every day, 180 minutes, or they know, and also if they know that the person may need a little bit extra time and they might be able to do everything within the short period inpatient rehab is in. And then the last part, they might go to SNF because there's already identified that the family won't be able to care for them or have someone in the home at all times when they get discharged if they were to go into a facility for a few weeks. So that's the other route. And then the place I work at, which is an intensive rehab facility, as well as individuals who do need to go to another facility before going home, but they can handle the intensity. And at that point, the person would have an intensive therapy of speech, physical, occupational therapy every day, 5 days a week, or maybe spread out across the week. That equals 900 minutes of that week of therapy. And we will be working with them and getting stronger with their mobility, their day-to-day activities like dressing, taking a shower, brushing your teeth, swallowing, speech, how you communicate. It could be speech or language of how you understand information from a language standpoint, because a lot of people who have a stroke have what's called aphasia. Or it could be the thinking skills too that a speech therapist works on. So, and trach, I forgot about that. That's a big part too, in communicating. So there's a lot that goes into that. And then after that, Some may go to outpatient or home health. So um, that's typically how it looks. I know that's a lot, but it's just there's many different places people can go to after a stroke. But rehab is the big picture of it. You definitely want that rehab.
Rehab can make a lot of big difference.
Yeah.
I'm glad that I had the rehab. So, what does rehab mean? Because I know there'll be people all around the world watching this, and this whole rehab can mean different things. So, what does rehab mean?
The closest thing I'm going to say, the way I always phrased it, and truthfully, this is how I got into the world of rehab, is helping someone get back to where, in terms of stroke rehab, because it looks different from a when you're working with peds and someone who has not developed the skills yet. But from a stroke rehab perspective, it's helping someone get back closer to where they were before.
Oh, that's a good simple
Yeah,
uh explanation.
yeah,
Explanation. Okay. Thank you for sharing.
yeah, absolutely.
I I I, I thank you to all the viewers that are watching, the replay viewers especially, and for the ones that are watching right now. Thank you. I appreciate you. I appreciate it. Uh, so, how long does rehab take?
The answer to that is, it's hard to say. I'm going to say what I say generally, and I hope this makes sense. Is I say it's a journey. And I say, and it goes hand in hand with recovery, right? Recovery is a journey. So rehab could take years, to be honest. Some people are in rehab for years. Some are in there for just a year or less. And it can start, it can finish, and then something else happen, can restart again. So it's really one thing that one of my colleagues told me early on in my career was, our patients are with us forever, and I took that to heart. I took that to heart. It might not, and in the true sense of like insurance paying for it, there's a cutoff. But then in terms of things that could, continue to happen, it continues, right? With it, as we're going to talk about, like reintegration to the community. So there's many patients who come in more from an outpatient standpoint. So individuals not coming back to inpatient rehab, to get more therapy. But in terms of outpatient, there are some times, well, hey, I noticed this now. Can I get therapy for this? Or so rehab can be, a start finish, but generally, from a technical standpoint, someone could be in there for, a year, maybe even past a year after a stroke recovery.
That was good advice
Yeah.
because I had a stroke. It's going on 3 years, 3 years, and remember that stroke is a journey.
Mhm.
Stroke is a journey,
Mhm.
and it doesn't just it. It could be a long term. It is a long. Not it can be. It is a long term event.
Mhm.
So I on this side of my face, I can feel the numbness,
Mhm.
and it affects a lot of different things. So it is nice to be able to talk to someone, and who knows what you've been going through.
Yeah.
So thanks for sharing that. My
So
next question is, uh, what is the community's involvement in the reintegration coming back? What's the community involvement like?
So just for clarity, do you mean how does the community impact recovery? Like it being involved in the community impact recovery? Yes. Okay.
Uh,
So in terms of that, it's essential. It's essential. And I want to reference, because everyone's a little different, that community could be your family, community could be your circle of friends, community could be your church, community could be so many different places for a person. But socialization, and I'm a speech therapist, so this is really, this is the thing I love to talk about. But socialization is so big with recovery. There's quite a bit of research, I think, coming out right now. What they're looking at, they're looking at someone who's had a stroke and isolates, and we know what isolation does in its well, isolation itself can be very detrimental to a person, period. Regardless if you had a stroke or not, or regardless if you had any injuries. But isolation after injury is pretty significant, and it doesn't help a person recover as much. Whereas a person they're looking at who has been socialized and does have a community, they've noticed that their recovery looks different, and the gains they make look different. And so, in terms of involvement in community, it looks different from everybody, but that socialization piece, you're communicating, right? You're able to utilize those strategies you're learning in therapy. That community involvement of getting out and moving, not just if you're just thinking about, take away the speech and the thinking, but just movement makes a big difference, because you're going to different environments. You educate, you go out to be educated and learn, like you're building on the blocks of everything that you've been taught in rehab, and applying it to your day to day. But that's it's the bread and butter of helping you to continue to recover.
That's very important.
Yeah.
I'm so happy I had that help
Hmm.
because it is hard when they are so called normal.
Hmm. Hmm. Hmm.
Other day it's like starting over.
Hmm.
So
Hmm.
uh, I appreciate all the rehabs I had. I had stroke. I had the verbal speech therapy. I had learning to learning the PT, and which stands for physical therapy, and then I had uh OT OT stands for occupational therapy. So I had all three, and it was. I didn't realize how helpful it would be when I got home. The things I learned was so helpful.
Yeah.
I said, "Oh, I wish I knew though that I was helping myself."
Hmm.
So, thank you for that.
Yeah, absolutely.
Uh, and then, uh, thank you so much, Denise. I think that Denise is putting in the comments. And don't forget, at, we are at right now. We're only on YouTube. YouTube is free. We are at, and look at the bottom of the screen there, at Stroke for Healing. That's the name of the site. And uh, we do different things. We do interviews, we do solo, where I just be talking, and sometimes we just do different things. And we want to have fun.
I love
Mm.
it.
Listen, why you wear this necklaces? I love color,
Yeah, it's
and
beautiful.
I love to travel. And I got this one from the lady one. These are from Africa. I
Mm.
love Africa. So, and my husband is doing the travel business right now. And right, because I am passionate about stroke for healing. And so, if you have questions for Miss Jessica, put it in the comments below. and she will be checking it, and I will be checking it, and we will come back to and answer the questions that you may have, and or the concerns, or the concerns you have. Okay, I just wanted to stop and say that. Okay, are there programs you would recommend for the community?
Therapy programs or just things that are going on in the community or both?
Oh, whatever you want to share.
Okay. Well, I mean, I'm not here to advertise where I work, but I will say that I do work at a great place to provide that provides rehab right pretty much right after your the acute stage. So I'm in intensive rehab facility inpatient, but we also have outpatient. I don't say so. I always recommend our Orlando Health family from that end, and I don't say because I really work there. I have seen family members not in this area, but who've dealt with strokes and other diagnoses. Um, and I see the difference. I see the difference in terms of like the heart and the care there. And so I work there and I know the care and the heart of the people, which is the reason why I would always recommend it. But one thing I will say to people, and I'd love to share, in terms of the rehab process of finding a place, 'cause I know that's extremely hard for a lot of families. Them the key things I always say to look for. So if it it doesn't, I'm not saying just us, but anywhere you look for if you're a family member, go there and visit. And yes, ask about the therapies, ask what you're going to get, but see how the people interact with you and if they're truly standing out of care. Because the first thing you want is someone who's going to care, like who truly has a heart for caring, to care for your loved one. That's number one. They have a heart for caring. That's the building block of it all. The other thing is you want to ask them, you know, outside of the therapies, what else do you provide? What other opportunities or resources or activities do you have and offer here? You want to ask, about if you have specific things your loved ones dealing with, whether it be like they're eating or they're walking, you know, ask it, can I see where the gym is? Look to see what they have going on. Can I, is there any way you can tell me what the therapists do? Engage with them and ask them, deeper questions that are important to you and what you want that your loved one to gain from being there. So that's anywhere. That's the first thing. In terms of programs in our area in Central Florida, Orlando, we have quite a bit of things going on. So as Eva knows, we have the Neuro-Friendly Restaurant Initiative and restaurants that cater to different foods that are heart healthy, blood sugar friendly. And we don't have a lot of them right now. We have one that we're dealing with, the Smoothie Room in Soto. So that's a place that kind of caters to having adaptive utensils if you need it. They only have smoothies though at this location, but definitely with the menu, you'll see different options that might help you with your diet. As many people, that's a big struggle after a stroke. We have adaptive sports that's offered in different clinics, and all this can be found on our website, Orlando Health Advanced Rehab, which is under Orlando Health. So you go to Orlando Health and then you write in Advanced Rehab. They'll talk about what we're involved with within the community. So we do a lot of different events that are typically, presented on there. And if you ever want any more questions about other events that we have, um, definitely go to the site's log. It should be posted or send. There should be email you can reach out to so you can get more information that way. If you are a stroke survivor, I know Eva is well aware and she's involved. It's the stroke support group that we offer on a monthly basis, which is really, and Eva, you can say more than me about how beneficial that group is. It's the last Wednesday of every month at our rehab facility. So those are a few things I would say going on from programming. We're trying, my heart is to continue to develop and with that because there's always a gap and there's always a need.
Just like having a stroke,
Yeah.
it will be a journey.
Yes.
If you are you have to come back to Stroke for Healing because I will be interviewing someone and then I highly recommend. And then, are you involved with the stroke groups, the monthly groups? Because it has been so helpful for me. Thanks for mentioning it, even though maybe, uh, that may be different from your area,
Mhm.
but it's so helpful to talk to other people who had a stroke or who are caregivers, and that what and they have the tips that are good for to that are good for us, and the uh even uh talk about different things each month and share what the things that we are going through. You can share online like this, or you can share in person.
Mhm.
Connect them. It's so important.
Absolutely.
It's so important.
I have one more thing too, Eva. You just reminded me to add to that. The support group is virtual too, so if you can't attend in person, that's another way. And if you're, I forgot, if people are here, it might not be from our area. The American Stroke Association online has a lot of different resources and information about support groups also across the nation.
Good.
They also have a global perspective too. So if you aren't here in the US, they may have some connections there too. So feel free.
You share the with. I'm sorry to
Yep.
interrupt.
Yeah, absolutely.
Uh, can you share the website in the uh? You can share it in the comments because that site is so helpful. I
Mhm.
been meaning to share it. So thanks for
Absolutely.
mentioning that.
I'll put that in right now. I'll type it, just try to make sure I got the brief. I always just type in American Stroke Association. So I will put it in the chat right now.
Yeah, and uh, again, if you are have uh, occurred, thank you for watching, and if you are a replay viewer, when you put in the comments, replays rock. So that means you've been here before and you're sharing. Oh, it's very good. She put, is that the site
Yep.
org?
Yeah.
Okay,
Yeah.
thank you so much. But
Absolutely.
I hope you have your pets been writing down or watching again to see those the links we are sharing. Okay, and another question I have: any tips you could share? I was asked this question. You could share with the families of those who have from a stroke.
The first thing I'm going to say is be patient with each other. That's the number one thing, to be patient. Um, and to be flexible, be open to things might being different. And even if it's for an interim of time, but things will change and they might change again and they might change again. So you have to continue to be flexible and be open to, what else could be, what can life look like now? I know it didn't look like this before, but how can we adapt? How can we do the same thing maybe, but maybe a different way? And don't start everything. I always tell my patients and families before they leave, less is better than more. And that's from a neurological standpoint too. If you're putting a lot on, it can make a survivor, your loved one, be overwhelmed and I might feel really tired, nerve fatigue, or your brain gets tired a little bit more quicker than it did before. Is significant. So you want to, clean your slate off and add on and really prioritize the important things. And important is not the same for everybody. Like for you, is travel, and for someone else it might be a different thing, right? So prioritize the things that are important to you, and be open to accommodations, to even taking a break to come, and find and doing baby steps to get there. And I also, if it's okay, but I want to say something to actually not just the family members, but for the friends and the inner circles of survivors is be engaged. You know, a lot of times, and I'm not a survivor, so I don't say this as one, but I've seen it to many survivors, especially in my family too. Um, be engaged, you know. Things might look different than what you experienced before with the individual, but that's that, but that person is still that your friend and your family as a different, you call it family. And continue being with them. You know, you too can adapt. You too can um, find different ways of doing the things you used to do before, finding new things to do. But like I said, socialization is big. And when it's not there, it's one of the biggest things people sometimes struggle with beyond the what we think about, the moving, the talking, but that piece is so big. So I invite those people too to be engaged in the recovery. Doesn't mean you have to be there all the days because you might not. That might be overwhelming. But those calls coming in, checking in, scheduling times to be together or doing things are extremely significant too.
That that is some excellent advice
Yeah.
because just because a person has had a stroke
Hmm.
doesn't mean that they want to be so isolated
Hmm.
from people. Because before my stroke, I have a friend. You have to go back and listen to at Stroke for Healing. I interviewed her before I had the stroke. I was so afraid of him. I never met him before. And she was taking care of him.
Hmm.
And after a while, I got used to it. Used to him, how he walks, how he talks, how he eats.
Hmm.
So that was gonna like I don't be afraid of us.
Hmm.
Just share and share something that's good. That was good to know. And then also remember this. I tried to say this uh when whenever I am doing an interview. I know some people do not understand me. I have it. That's an experience I have had. So if you don't understand me, tell me to repeat myself. Repeat. It's a gift from you to me.
Mm.
Okay, remember that. Share it.
Yeah.
That is very helpful. It lets me know that people care about me
Mm.
and want me to improve. I want to improve. I know that I need to improve. So, thank you for that. I appreciate the tips that you gave.
Absolutely.
Okay.
Absolutely.
And then, uh, is there anything else you would like to share?
I want to thank you. This has been an experience. I, I always enjoy, beyond sharing but I guess you could say extra skills um, that I can provide from a therapy standpoint is just, sharing to the community and providing some, education, feedback, tips. I feel like the more people know, the better you equipped you are. Um, so yeah, I just want to thank you for letting me be on here today because it's definitely been an honor. I feel like I learn a lot, when I'm in these places. And I feel like a lot of people are learning from your podcast right now. So thank you for everything you're doing and what you're sharing with the community, because you're bringing people on that people don't have access to. So you're creating a bigger world for people and even for people who may have not had a stroke before or have no loved one. You're giving them information that they might be able to, they might not have known they needed to know. So I thank you for the space that you've created. And I just hope that it continues to expand from here. And I would love to come back. I would love to come back. Always
We
love to do anything.
we would love for you to come back
Yeah.
and share with us how can people get in touch with you?
Let me go ahead. I'll put my email address on here, my work email, so that way um, they can send me an email if they would like to.
Or they can put in the comments their questions, and then we can share with other people. But there are times when you want to talk privately. I understand that. We, so thank you for sharing your information with us. We can check back in the comments at Stroke for Healing. Right now, I'm on YouTube, and a lot of people don't know YouTube is free. FREE, free. So it's okay. You could go on my YouTube channel, and then I will have either at the last they and you there was a meeting, a yearly meeting, and there's that about aphasia. I said, for people who don't understand me and people who say, how do I get in touch with you? They can go to on the back. I have a thing, and then they can uh get in touch with me and go directly to my side.
Mm.
Okay? And the remember to share SHRE with not just anybody. Share with people that can be, this will be helpful. Okay? I want you to share it with people that are helpful. So again, thank you, Miss Jessica, for being interviewed today. And I would end my podcast with be a blessing
Mm.
to someone else. Be a blessing to someone else. Not you can do that for me. Be a blessing. Thank you so much. And please don't hang up at the end. Even though I will fix our end thing. I forgot to tell you to just stay there. Okay?
Bye.
Well, thank you so much.
You're
And
welcome.
bye, everybody.
Bye.
Bye bye.